GSQN and its ability to help us contain cost and improve quality is paramount to the future of being competitive in healthcare. Employers and populations in the future will be bidding out their healthcare needs to the persons who can prove to be most effective in delivering that healthcare and most efficient in delivering that healthcare. And GSQN will allow us to demonstrate better quality at a lower cost.
Gulf South Quality Network is a clinically integrated physician network that currently has over 1,600 physicians in the greater New Orleans market. We provide the infrastructure to help physicians improve patient care, patient safety, and be more efficient with the resources available under today's healthcare delivery system models.
Well, the whole idea of clinical integration is to get the physicians, number one, to be talking to each other and looking at each other's data and trying to hold each other accountable.
GSQN promotes clinical integration, I think primarily through the measurement of performance.
To not only look and see how other physicians work with you, but also to see your own quality metrics and your own ability to work with others.
What clinical integration and GSQN mean to our organization is the opportunity to work with doctors in a new way, the changing environment from a fee-for-service model to taking care of populations, and it's a perfect fit for a community hospital.
What clinical integration does is opens up a toolbox of tools for us to look at how we are performing compared to our peers. It gives us tools of looking at the data not just from one patient or one doctor, but across a whole population of patients that we've never had before.
Our ability to demonstrate better outcomes when we serve our patients and our ability to look at the data and raise the bar allows us to be more attractive not only to the payers, but other buyers of healthcare that are seeking alternatives to what's currently available in the marketplace.
With our partnerships, we're demonstrating that we're going to provide quality care, we're going to provide efficient care, and again, that's that combination that forms value.
GSQN affords that opportunity for the ability to measure those things that we previously were unable to measure, the infrastructure necessary to measure them, and the leadership to change the mindset and thinking of the physician community to work with us on that.
When you talk about clinical integration, you're not just talking about the doctors talking to each other, you're talking about the insurance companies, the hospitals, the providers of health care, the physicians, as well as the home health providers, all working together for the benefit of the patient.
Our ability to bring hospitals and physicians together and look at current performance, look at current reimbursements, and look at opportunities for improvement is the only way we're going to be able to achieve our missions within each of the hospitals and the goals of the physicians as healthcare reform continues to enter our marketplace.
To make it attractive to a payer, such as Blue Cross or Aetna or United, you have to cover enough lives to make it worth their while to sit down with you and set up a separate network with you.
Our ability to expand to provide coverage within the greater New Orleans area makes us more attractive to those business owners who are seeking solutions for a higher level of care.
Clinical integrated networks, GSQN included, have to address broad populations geographically so that when an employer is in need of a health plan that can meet their needs, addressing health reform, you have to address where the people live.
With the regional expansion, I think our goal is to use the resources of the other chapters. Use the top performers of one chapter and have them come together and assist other physicians at different chapters. And we can all learn from best practices.
GSQN is focused on providing the highest level of quality care by integrating our physicians around quality data and people working with them to understand the data and understand opportunities for improvement.
It helps us to show people that as a group, we can change the quality of healthcare in the region. And I think to me, that's a very exciting thing to be able to say, that I'm part of a regional group that changes healthcare in my region.
We know that patients are taking a more proactive role not only in determining are the physicians providing quality care, but are they doing it in a cost-effective manner, just as insurance companies are. Patients are doing this. So the combination of these strategies, these quality measures, are again, revving everything up towards that value concept.
The technology that we have available at GSQN is going to really make a difference in having a Hawthorne effect, as well as once you're able to act upon it, we'll even prove it further.
Technology is very important in the success of GSQN. Our tools that we utilize are very important in our physician membership. It allows physicians to look at a wide array of measures and metrics. And really what that does is allow physicians to get a sense of, are they providing value?
What's my actual mortality? What's my infection rate? What's my readmission rate? What's my complication rate? That data, it will be out there. It will be available not just to me, but to my colleagues who are trying to improve care across the entire network.
There's a saying that you can't manage what you don't measure, and I think that transparency allows us to measure what we're doing and then manage it.
Just as physicians learn to log in and start looking at their numbers, that the numbers start to improve because it's something that they're now aware of. It's something that is measured for them, which our physicians have not seen before.
An entity like GSQN is going to be absolutely pivotal to success between insurance payers and providers. GSQN is not insurance company, nor is it provider. It's actually kind of this entity that's bridging the gap between an insurance carrier and the provider to bring people to the table that typically are adversarial to try to make them work together towards a common goal.
The future for GSQN, I think, is very bright, as it is for any group of physicians and providers and payers that get together to try to focus on value.
Being a part of something that is trying to provide quality care at a better cost for the people that I care about is being part of something that's just alive and exciting and growing.
It's been a fantastic journey for a lot of physicians, into some of the complexities of the healthcare industry today. You'll be able to concentrate on taking care of patients and then look at a data set for how you're being compared for your performance and have some feedback that'll be valuable not just to you but to your patients.
GSQN allows Slidell Memorial Hospital and other small hospitals that might otherwise believe in the future of healthcare they don't have a place to be part of something that has a bright future.